Hello and welcome to the latest podcast from the Staffordshire and Stoke-on-Trent NHS Clinical Commissioning Groups. I'm Richard Caddy and today I'll be talking to Vicki Rowe of Midlands Partnership Foundation Trust, that's MPFT. During the COVID pandemic, Vicki has been working as a supertrainer. That's a new role set up specially to help support all the area's care homes as they've battled to protect residents from coronavirus. Hi Vicki.
Hello there.
You've been working during the COVID crisis as one of Staffordshire and Stoke-on-Trent's super trainers. We'll talk a bit about what that means shortly, but could you just give us a bit of a rundown on your career to date?
I'm a health visitor now. I've been a health visitor for many years, but prior to that I worked as a nursery nurse working with the health visiting team for the trust, and the trust seconded me to go off and do my nursing, so that's what I went and did. And again, I then went off to do my health visiting training and then became a health visitor back in 2010 for the trust, and I've been with them ever since, up until recently when I went on a career break. So I've been on a career break now for a year and a half.
So when COVID struck in sort of February, March, what were you actually doing at the time?
So I'm living in a pub, which is all locked down at the moment.
Right.
My partner runs a pub, and so we're living here. So yes, I've been on a career break and living in a pub that's all locked down.
Presumably you were one of these people who was asked to volunteer to return to work, or did you get in there first?
Well, I did, yeah. I contacted my previous team leader and said that I'm here, I can help, what can I do to help? Obviously, being nurses, immediately we want to try and help and put things right and make things better. So I gave her a call and agreed to come back and do what's called my kit days, my keeping in touch days, which is part of my career break. And that consists of me completing all my training, making sure my training's up to date, and then helping out with the team wherever I'm required to do so once all my training is back up to completion.
And I think it was very much a case with a lot of people that came back was you deployed where you needed most.
Absolutely. And obviously after that, I was quite happy to help and really eager and keen to get in and get involved and get help and to help out. But obviously it was a big logistical problem for the trust, for MPFT themselves, to obviously try and get people redeployed to areas that were needed. So it was a real big push for them to do that and logistically for them to get that organised. So they agreed for me to have to break my career break, to come back to try and help and to be redeployed. So that's what I was, redeployed into the infection control team to help with this super training.
Most people won't have any idea what a super trainer is. So can you just explain to us why there was a need for super trainers and then what a super trainer actually is and does?
It sounds very grand, a super trainer, but what it was, they put together a care home support package. So it's a care home mutual aid infection prevention and control training support package that they wanted to put together for the care homes across of England and offer some support around the PPE. So from that, the supply was obviously the issue that they needed to get out there and make sure every home had got the equipment that needed. But also part of that is they wanted to make sure they'd got the support from the infection control teams, which were going in and supporting homes and have been doing for a long time, but also offering something extra. So giving them that support in the training of how to put on this equipment, don the equipment, and also to take off the PPE, which is the doffing of that PPE. So as a super trainer, we were trained and invited to training with the Royal National Orthopaedic Hospital. And we did this virtually, and they gave us all training. And then the idea is that us as super trainers were to train local trainers from the local authorities, CCGs, adult social care, for them to then train staff in the care homes, for them to then train their staff how to put it on correctly and how to take it off correctly.
So it sounds like it's some sort of cascade system with the super trainers at the top, then training more trainers who then themselves go into care homes. Is that either virtually or physically? Yeah,
trainers training trainers.
Staff in care homes presumably have to use PPE to a certain extent during the course of their normal work, but how has COVID changed that?
Yes, so COVID has changed that because obviously we're dealing with an infectious COVID-19 infectious disease here that we can't see, and from the difference really being around the masks they're wearing, and it's when they're putting it on and how they're taking it off to obviously stop any cross-contamination from that.
Have you just been training trainers, or have you actually been going into the care homes themselves?
Yeah, so originally we started off being the super trainers, the idea being from the government that this was given to our CCGs at the beginning of May. And by the 29th of May, they wanted all homes in our trust, our MPFT trust area to have been trained. So ideally at the beginning, we're all training 10 trainers, which will then train 10 care homes, which worked really well to start with. But then suddenly these people that had agreed to do it were also doing this on top of their own job.
Yeah.
So suddenly they may have been pulled back into their own job, or something happened, so it meant they couldn't continue, or they just ran out of time to fit these care homes in. So after doing the super training and training some trainers, I then ended up supplying some support into the care homes themselves.
So are you mainly actually physically visiting them, or are you doing the training online?
No, we are doing both. Ideally, they wanted us to do face-to-face, but obviously in this time that we're in, social distancing is very important, and a lot of homes aren't wanting people in, quite rightly. They're trying to keep them isolated. So I was trained virtually, so we're training a majority of them virtually.
Is there a particular reason why you go into some homes and not others?
Some homes will ask us to go in, they prefer it that way, or they've got more members of staff that they're trying to ask us to train. So virtually we may only have 4 or 6 people on at a time to train, sometimes only 2 out of their workforce, and they train then the rest of their staff. Others have just got more members of staff that they want us to train. Each nursing home is different. They come in all shapes and sizes, from very small to only having maybe 6 residents. Others are much larger, so then may have facilities for us to have a separate room to even go in. I mean, on the sunny days, I even managed to do one lot of training out in the garden, so I didn't even enter the nursing home. A couple of the nurses came outside and we did it outside.
Well, if the weather's nice, why not enjoy it?
Yeah, exactly. That's what I said to the staff. Come on outside. The sun is shining. So it all depends on each individual case.
Was it mandatory, this training? Did care homes have to receive it?
Across Staffordshire, they all were trained, either locally or nationally. They all took on the training.
And generally, how well received was it?
We had mixed feelings. Majority of the time, it was very well received once they had the training. I think to start with, they were asking things like, why do we need this training? We're already putting on our equipment. Why should we do it? And I think with a little bit more explanation of why we're doing this, how we're trying to spread it across the whole country to get a national standard, they were more willing to participate. And then afterwards, I think everybody I've trained have definitely taken something from it. So it's been well received. Several homes have said, why is it only now? Wished they'd had the training a little earlier. So that was the biggest feedback I had negatively.
Okay then, Vicky, could you please just describe what one of these training sessions looks like?
Yes, certainly. So what we do is we make sure they've got their equipment ready, and I've got my PPE equipment, which would consist of a fluid resistant mask, a pair of gloves, an apron, and my visor and my hand gel or sink if we've got soap and water at the side of us to be able to see to do that, to wash our hands. So we talk about the staff and making sure the staff are looked after, they stay well hydrated. Wearing PPE equipment, as you may have realised, is really exhausting. So we do need to look after ourselves and make sure that they look after their staff and they have plenty of drinks and breaks so they can have a drink. And then we talk through about how to put that equipment on. So what I would do is I would then demonstrate to them a good hand washing, the 20 seconds with the gel or the soap and water and drying of my hands, being bare below elbows. Then I would proceed to put on the PPE equipment. So I'd explain how to put it on. Once on, and after I've taken care of the residents, how I would take the equipment off and how to do it without cross-contaminating myself or the environment, and making sure that we're washing our hands in between each stage that we do that. And then how to dispose of that PPE equipment and making sure the area is clean when we're finished.
I think it's been very well published that a lot of the impact and a lot of the deaths throughout Corona have come in care homes. How have you found morale? Because the National Audit Office has said recently that about 1 in 3 care homes have had positive COVID cases. How have you seen that impact on the staff working within homes?
I came across a couple of nursing homes where a couple of members of staff in different nursing homes was very emotional, exhausted, tired, lack of staff. Staffing had been an issue. A lot of them they'd had staff that had been off due to members of their own household having symptoms, so they couldn't come into work, which had depleted staff. Other staff members had moved in and had been in there and been staying in homes for a long period of time, and exhausted. I think now they feel that suddenly there's a lot more support for them, but they are being contacted daily for information about if they've got any more cases, the support for their testing. So the testing is now going out in all homes for them now. So again, that puts their mind at rest. Also, new guidance came out for them to contain anybody that they suspected of having COVID or been confirmed to, or anybody that's been out from hospital and coming back into the homes, that if they can isolate them for the 14 days, that's what the guidelines had changed to. So that had made it easier for them. People like myself contacting them, going in, doing a bit of training, somebody else to talk to, checking that they're just doing it right. So suddenly they've got the infection control nurses that have always worked with these homes are going in and also working with them with the prevention and infection control. So suddenly they got a lot of support.
Care homes aren't part of the NHS, but there is a mutual dependency, isn't there? Do you think this will change the nature of how care homes and the NHS work together?
Oh yes, I do think so, and I do hope so. Looking at it now, the fact that we're going in, doing some training. The infection control nurses always went in and had good links with these nursing homes, but hopefully now that there'll be a lot more training blanketly going across to help and support the care homes, because at the end of the day, they are helping and supporting the NHS by caring for these individuals. So definitely going forward, I think it will raise the bar and hopefully support each other the way it should be done. We achieved our 100% in our trust, so that was great that we managed to cover all the care homes and get the training in there for them and offer that across. So that was a really good mark for us. And because now we've completed our nursing home, care home side of things, we're branching out now. We're being asked to cover learning disability homes, local small hospitals. I've done one today where they've got eating disorders in there, teenagers with learning disabilities living in units. So we're going over it for them as well. And again, they're receiving it really well. But we're also aware of the fact that actually the staff that are coming into these homes are now extending the number of people that they're coming into contact with in their own times. Our bubbles, shall we say, are getting bigger. So actually, we need to protect the residents and the patients from ourselves. So we need to know how to put it on and protect ourselves correctly.
So I think everybody's now hopefully we're moving out of the other side of this now. And people are saying, what are the things we've done differently that we ought to lock in? Have you got any? Will this change the relationship, and will it change it for the better?
It'll definitely change it for the better. We've learned things that just we didn't know about before, thought about things in a bigger picture. I mean, a lot of people talk about we looked at the NHS, but we've really got to look at the homes and the other respite care homes and hospitals that are out there to help support them as well, because we're all in this together. And maybe looking back what we could have learned, should we have done more quicker? I don't know, but we're there now and we've made those links. We've worked across boundaries, as in different areas, the local authorities, the CCGs, the adult social care, as well as ourselves, working across different areas, and we're all pulling together to help support. So I think that's been good. I've definitely enjoyed that side of it, meeting and working with different people that I wouldn't have necessarily worked with before.
Thanks, Vicky. I think the one more question I really do need to ask you is, are you looking forward to the pubs opening again?
Yeah, definitely looking forward to that. It's very quiet round here. I want to share the beer garden with everybody. Hopefully you'll be able to have a party, but it sounds like this social distancing will be with us for a long time yet, so we may have to do it at a distance, but certainly yes, it'll be nice to be able to pull a pint again to let somebody have a drink.
That's great. Thanks a lot, Vicky.
No problem. Thank you very much.